Have you ever wondered what it's really like to access healthcare in Canada? You might have heard people say that it's free, or that you have to wait forever to see a doctor. But what's the truth? Is Canada's healthcare system the paradise it's often made out to be, or is there more to the story? If you're thinking about moving to Canada, or if you've just arrived, understanding the healthcare system is crucial. In today's video, we're going to dive deep into what Canadian healthcare really is, why you might need health insurance, and how to make the best decisions for you and your family. Hello and welcome to the channel. If you're new here, this is your go-to place for everything related to moving to and living in Canada. We provide the latest Canadian immigration news, helpful tips, and in-depth guides to make your transition to Canada as smooth as possible. Make sure to check out the links in the description for free resources and guides that will help you along your journey. And don't forget to hit that subscribe button so you stay updated on all things Canada. Now, let's talk about healthcare in Canada. It's one of the most talked about topics when people consider moving here. You might have heard that healthcare is free in Canada, and while that's partly true, there's a lot more you need to know. Canada's healthcare system is publicly funded, which means the cost of most health and medical expenses is covered by taxpayers. This single-payer system is one of the things that makes Canada an attractive destination for people from around the world. But is it really as simple as working, paying taxes, and getting free healthcare? Let's start by clearing up a common misconception. When people think of Canadian healthcare, they often imagine a national system that covers everyone equally, no matter where they live. But that's not quite how it works. Canada doesn't have a single, unified healthcare plan. Instead, each province and territory manages its own healthcare program, and this can lead to some significant differences depending on where you live. So, what does that mean for you as a newcomer? When you move to Canada, you'll need to apply for healthcare coverage in the province or territory where you'll be living. Each province has its own set of rules and requirements for accessing healthcare, and the services covered can vary. For example, if you move to British Columbia, you'll be enrolling in the Medical Services Plan, or MSP. In Ontario, it's the Ontario Health Insurance Plan, known as OHIP. While there are similarities across the provinces, the specifics can be quite different, and understanding these differences is key to making sure you're fully covered. One of the first things you should know is that there is often a waiting period before your healthcare coverage kicks in. In British Columbia, for instance, there's a 3-month waiting period from the time you establish residency before MSP begins to cover your healthcare costs. That means if you move to Vancouver, for example, and something happens before your coverage starts, you'll need to find another way to pay for your medical expenses. This isn't unique to British Columbia. In Ontario, there's a similar waiting period, although some provinces, like Nova Scotia, may offer earlier coverage to new residents. It's crucial to check the rules for the province you're moving to so that you're not caught off guard. Now, let's talk about what's actually covered under these provincial healthcare plans. Basic healthcare services, like visits to the doctor, hospital stays, and emergency services, are typically covered. However, not everything is included. For instance, prescription medications, dental care, vision care, and even some types of surgeries may not be covered, depending on where you live. This is where private health insurance comes into play. You might be wondering, why would I need private health insurance if Canada's healthcare is so great? The truth is, while the public system covers a lot, it doesn't cover everything. Private health insurance can help fill in the gaps, ensuring that you have access to the full range of medical services you might need. For example, if you require regular prescription medications or need to see a specialist that isn't fully covered by your provincial plan, private insurance can help offset those costs. It can also provide coverage for services like dental work, eye exams, and mental health support, which are often not included in provincial plans. For newcomers, having private health insurance can be particularly important. During the waiting period before your provincial coverage begins, private insurance can ensure that you're covered in case of unexpected medical needs. It's also worth noting that depending on your visa status, you might be required to have private health insurance as a condition of your stay in Canada. This is especially common for international students, temporary workers, and visitors. Even after your provincial coverage kicks in, you might find that private insurance is still a good idea. Many employers in Canada offer extended health benefits, but these benefits can vary widely. Some plans might cover dental and vision care, while others might not. Additionally, employer-provided health benefits often don't start until you've completed a probationary period, which could leave you without coverage for a few months. Having your own private insurance can provide peace of mind during this time. Another thing to consider is that healthcare in Canada is not entirely free, even with provincial coverage. For example, if you need an ambulance, you might be surprised to find that you'll be billed for the ride. Similarly, certain emergency services and prescription drugs might come with out-of-pocket costs. If you travel outside your home province, your coverage might not fully extend to where you are. For instance, if you live in Ontario but have an emergency while visiting Quebec, you could face additional costs for services that aren't covered by OHIP. So, what's the bottom line? Canada's healthcare system is one of the best in the world, but it's not perfect. Understanding the limitations of provincial coverage and planning accordingly is essential, especially if you have specific medical needs. Private health insurance can be a valuable tool to ensure that you and your family are fully protected, no matter what life throws your way. Whether you're waiting for your provincial coverage to start, need additional services that aren't covered, or simply want peace of mind, private insurance can provide that extra layer of security. If you're thinking, this all sounds a bit overwhelming, don't worry. We've got you covered. Check out the links in the description for free resources and guides on how to navigate the Canadian healthcare system and find the best private health insurance options for your needs. Before we wrap up, let's circle back to the question we started with. Should you get health insurance in Canada? The answer depends on your personal situation. If you're planning to stay long-term, understanding your provincial coverage and the potential gaps is crucial. Private health insurance can be a smart move, especially during those initial months when you're still getting settled. It can also be essential for accessing services that aren't covered by the public system. Remember, healthcare in Canada is generally excellent, but it's not one size fits all. Your health is too important to leave to chance, so take the time to research your options and make sure you're fully protected. If you have any questions or need more information, don't hesitate to reach out. We're here to help you every step of the way as you make Canada your new home. If you found this video helpful, please give it a thumbs up and share it with anyone else who might benefit from this information. And don't forget to subscribe to our channel for more content on living in Canada. Thank you so much for watching.